most common type of infection seen in the body, and 1 in 5 women will develop one throughout her lifetime. UTIs are caused by bacteria entering the urethra and traveling its way up into the bladder. If left untreated, this can lead to a kidney infection, which can be a serious health problem as the kidneys are responsible for removing waste and toxins from the body by producing urine. By the end of this video, you will have an understanding of the causes of UTIs, the signs and symptoms associated with them, and the ways in which to prevent yourself from getting one in the future.
I have had at least 10, probably 20 or more. I've had 1 month where I had 3. I have had 2 that have turned into kidney infections. The first thing that I notice when I'm developing a UTI is the urgency to use the restroom. Not just to use it more often, which is also the case, but once you're done urinating, you still have the urgency to, and it's very uncomfortable. The pain gets better when I take these little orange pills that the doctor prescribes. Also, drinking lots of water helps so the bacteria is not so concentrated, I suppose. Like, that's what my doctor told me, and so I try to drink a lot of water. I'm always flushing the fluids through my body. I don't hold it in when I have to urinate, because that just keeps bacteria in there that you don't need. I pee after sex in order to cleanse everything out, and I make sure to wash myself very thoroughly. Don't wait until it gets so bad that you cry. They do not go away on their own, ignoring it until it gets terrible. It's excruciating pain. That's not the way to do it. If you just go in when it first happens, they're going to get rid of it before it turns into a kidney infection. I think it's really important to go in the moment you have a symptom. So when you go to the doctor, the first thing they're going to ask is for you to give a urine sample. The doctor is going to ask you questions. What are your symptoms? What have you been feeling? Have you felt an urgency? Has it burned? Answer these questions, and likely the doctor will know whether or not what you have is a bladder infection before the analysis comes back. But once it does, they'll understand what bacteria it is, and they should prescribe you a full course of antibiotics. The antibiotics, it's so important to take the full course. The month where I had 3 urinary tract infections, there have been doses that I had missed and I had just made up for the next day, and that's not how antibiotics work. You need to take them exactly as directed. You need to take all of them, and you need to be consistent about it. Not ignoring the symptoms, and peeing after sex is a big one. Drink as much water as you can. Keep yourself clean.